What if the tingling, burning, or swelling in your feet is not just a sign of aging, but an early warning sign of diabetes already showing itself today? And what if your feet are signaling that risk before most people ever think about having their blood sugar checked? I'm a doctor, and I have seen changes in the feet lead patients to diagnoses they never expected. Today, I'm going to explain this clearly and simply, without medical jargon, fear tactics, or confusion. Because this is very easy to miss. I'll walk you through 9 warning signs and what they may mean. It is not always just tired feet. Sometimes it is a deeper clue. Stay with me, because near the end I'll share a simple 10-second foot check habit that older adults can use with ease. Welcome, and thank you for spending this time with me today. Your feet may be showing signs of blood sugar trouble before any other part of your body feels obviously wrong or concerning. Many people miss that. That is because diabetes often begins very quietly, and the feet are one of the first places where that silent damage becomes visible. High blood sugar can irritate the nerves, affect circulation, dry out the skin, and slow the body's normal healing process. Those changes do not always come with intense thirst, sudden weakness, or an obvious feeling of illness at the beginning. So people often explain them away as something minor. They blame age, the weather, their shoes, standing too long, dry skin, or a restless night after walking more than usual. I hear those explanations all the time, especially from people over 50 who still feel generally fine and do not suspect anything serious. Then a sore does not heal, the numbness spreads, or the skin slowly begins to change color. That is when the real worry starts to grow. I remember one patient who kept ignoring a burning feeling under her toes until a routine visit revealed diabetes, and she was completely stunned. She did not come in because she thought she had diabetes, nerve damage, or an underlying blood sugar problem. She came in because her skin looked unusual, the sensation felt off, and the problem simply would not go away. That story is very common in everyday primary care. Diabetes can begin damaging the small blood vessels and nerves before a person has ever been labeled with the disease, warned about it, given medication, or officially diagnosed by a doctor. Because the feet are far from the center of the body, bear constant pressure, and are easy to overlook, early trouble often shows up there first. That does not mean every foot symptom points to diabetes. And I want to say that carefully, because there can sometimes be other causes. But some patterns matter much more than others. And when several signs appear together, they deserve attention sooner rather than later, whether from you or from someone who cares about you. That is especially true if you have recently gained weight, have high blood pressure, a family history, or unusual fatigue. Older adults are more vulnerable here because healing can slow down, sensation can change, and common foot problems become even easier to dismiss over time. That is why family members should pay attention too, especially when older parents tend to minimize their symptoms. Some people hide their discomfort from everyone around them. Others gradually stop noticing it, and that can be even more dangerous when pressure spots, cuts, or burns go unnoticed for days at home and quietly get worse. That is one reason delayed care can turn a small problem into a much bigger one. Paying attention early changes outcomes in very practical ways. It can lead to earlier testing, better skin protection, faster treatment, and clearer guidance from a doctor. It can also help prevent infection, ulcers, and the chain of complications that can follow neglected injuries. Most importantly, it gives you the chance to recognize your body's signals while there is still time to respond wisely and promptly with the right support. So I do not want you to look at your feet and think only about pain. I want you to look more broadly every time. Notice the color, the texture of the skin, the swelling, the temperature, the sensation, the healing time, and whether one foot looks different from the other today. Repeating patterns tell the story more clearly than pain alone. In just a moment, I'll show you 9 warning signs in the feet, why people often ignore them, and when each one calls for action from you or your family. You will not need any medical terminology to follow this, even if health topics usually feel overwhelming. I'll explain what each sign may suggest, what else can mimic it, and when it is time to call a doctor. That kind of clarity matters now, not 3 months from now. And before the video ends, I'll share a short 10-second habit that makes checking your feet at home smarter and safer. It is simple, practical, easy to remember, worth waiting for, and far more useful than many people realize. Many people first notice something strange in their feet and call it fatigue. They blame a long day, older shoes, or getting older. That is often how early diabetes stays hidden. One of the first warning signs can be tingling, burning, or a pins and needles feeling that keeps coming back, especially in the evening. Patients tell me it feels like tiny sparks, buzzing threads, or heat moving through the soles. What may actually be happening is that rising blood sugar starts irritating the small nerves that carry sensation. Those nerves are like thin electrical wires with delicate covering. When sugar runs high too often, the signal becomes noisy before it becomes silent. Sometimes the same foot can feel both prickly and strangely tender, so the sheet or sock seam feels more annoying than it should. That mixed sensation confuses people. They think it must be overuse because it does not look dramatic. That matters because nerve damage can begin quietly, long before someone thinks of diabetes. A very simple next step is to notice the pattern for 1 week. When does it start? How long does it last? And does it show up more after meals or at bedtime? Bring that story to your doctor. Patterns matter. The second sign is not extra sensation, it is missing sensation. Some people say the floor feels dull, as if their feet are wrapped in invisible padding. Others say they can walk normally, yet the details of contact feel strangely muted. They often dismiss it as poor sleep, back strain, or aging nerves. But diabetes can reduce feeling before obvious pain appears. The nerve is still there, but the message arrives late and weak. That becomes risky because the foot stops reporting small problems clearly. A seam inside a shoe, a small blister, a pebble, or water that is too hot may not register the way it should. The daily habit here is practical and protective. Check bath water with your hand or elbow first, and glance inside each shoe before you slide your foot in. It sounds small. It is not. Loss of sensation is one reason a minor problem can grow quietly for days before anyone notices. I often hear this after someone finally gets checked. I thought my feet were just tired. That misunderstanding is common because the symptom comes and goes, and most people can still do their errands, drive, and sleep for part of the night. Function seems normal, so they assume the warning cannot be important. Early diabetic nerve stress thrives inside that false reassurance. Early diabetes is often missed for this reason. The first signs in the feet can feel easy to explain and too minor to matter, but the feet are already showing that the body's wiring is under stress. The next stage often becomes visible, and once that happens, the pattern gets harder to dismiss. Dry, rough, cracking skin on the heels is one of the most dismissed foot signs I see. People call it winter skin, poor lotion habits, or just a cosmetic annoyance. Yet diabetes can contribute to dehydration, and it can also affect the nerves that help regulate moisture in the skin. When that happens, the foot loses flexibility and small splits begin to form. Think of healthy skin like a soft protective glove. When it dries out and stiffens, it stops bending well and starts breaking at the stress points. Why does that matter? Because a cracked heel is not only a comfort problem, it can become an entry point for bacteria and fungus, especially when healing is slower than normal. The helpful habit is simple. Wash gently, dry carefully, and moisturize the tops and bottoms of the feet every day, but keep cream away from the spaces between the toes where trapped moisture can cause other problems. If cracks become deep, painful, or start bleeding, that deserves medical attention rather than another week of guesswork. Another visible sign is a color or temperature change that keeps returning. One foot may look paler than usual. Another may turn reddish after minimal activity, or look dusky in a cool room. Some people notice one foot feels colder than the other and assume that is simply poor circulation from age. The real question is why circulation is changing. Diabetes can affect blood vessels as well as nerves, especially the tiny vessels that nourish skin and tissue. When blood flow becomes less reliable, the feet may lose their even healthy tone and become blotchy, slow to warm, or slower to regain color after pressure. That matters because tissue with weaker blood flow is harder to repair and easier to injure. A wise daily step is to compare both feet in the same light each evening. If one side keeps looking darker, paler, colder, or oddly red, do not ignore that pattern. Visible change is often the body's way of asking for closer attention. Swelling is another sign many older adults explain away too quickly. They tell themselves they stood too long, had salty food, or were just sitting with their legs down. Sometimes that explanation is correct. But swelling in the feet or ankles can also reflect a larger metabolic strain, and diabetes often travels with high blood pressure, circulation trouble, and kidney stress. The feet may show fluid trouble first because they sit at the far end of the system all day, where gravity keeps pressing the issue. Shoes start feeling tight by late afternoon. Sock marks stay longer. the skin can look stretched or shiny. Why does that matter? Because swelling can hide wounds, reduce comfort, and signal that the foot problem is not only on the skin. The next step is to notice whether swelling is new, one-sided, or steadily worsening, and whether shortness of breath, high blood pressure, or blood sugar trouble is already in the background. Feet rarely swell without a reason, and the next signs can be even more telling. Repeated skin or nail infections can be another early clue, and many people never connect them to blood sugar. Athlete's foot that keeps returning, peeling between the toes, itching that improves, then comes right back, or thick yellow nails that slowly worsen are often treated as isolated annoyances. People think they just picked up fungus from a shower floor, old shoes, or damp socks. That can happen. But diabetes can make these problems more likely because excess sugar creates a friendlier environment for yeast and fungi, while the immune response may not work as sharply as it should. Add cracked skin and less reliable circulation, and the foot becomes easier to colonize and harder to clear. Why does this matter? Because infections that look minor on the surface can create openings, spread into deeper tissue, and set the stage for slower healing later. The practical habit is basic but powerful. Dry carefully between the toes, change damp socks promptly, rotate shoes so they can dry out, and do not shrug off a rash or nail change that keeps returning. A recurring infection is often a clue, not just a nuisance. One reason people minimize these signs is that they often respond a little to over-the-counter products then return. That on and off pattern creates false comfort. The skin looks a bit better, the itching settles, or the pain eases for a few nights, and the person decides the danger has passed. But repeating symptoms matter in medicine. A problem that keeps reappearing is often telling you the underlying conditions have not been corrected. That is especially true in the feet. The body rarely repeats a warning by accident. Pay attention early now. Another warning sign is pain that seems to arrive when the day is over. Burning, stabbing, aching, or electric-like pain that gets worse in bed is often blamed on age, old injuries, or the mattress. Many people assume serious foot trouble should hurt mainly when walking. Not always. When diabetes affects nerves, the signal can become louder at night because everything else gets quieter. During the day, movement and distraction compete with it. At night, the sheets touch sensitive skin, and there is nothing left to drown it out. Some patients say their feet feel angry after dark. Others say the blanket is what finally gets their attention. This matters because nighttime pain may reveal nerve injury that has been developing much longer than the person realized. The next step is not to keep guessing. Note whether the pain wakes you, whether light touch makes it worse, and whether the sensation feels burning, stabbing, or crawling. That description helps separate nerve pain from arthritis, circulation problems, or simple overuse. And once the foot stops healing normally, the stakes rise again. One of the clearest diabetes-related foot warnings is a cut, scrape, blister, or cracked area that does not heal on schedule. People often say, "It was tiny, so I thought it would close by itself." That assumption is common, and it can be dangerous. High blood sugar can interfere with immune function, damage the smallest blood vessels, and leave tissue with less oxygen and fewer repair supplies. Imagine trying to repair a road after a storm when the work crew is smaller and the supply trucks keep arriving late. The damage may look small, but the repair falls behind. A blister from a shoe edge, a crack at the heel, or a little split near the toe can linger much longer than expected. That matters because open skin is never neutral. It invites infection. The daily habit here is direct. If a foot wound is not clearly improving within a few days, or if it becomes redder, wetter, deeper, or more painful, seek medical care promptly. This sign includes more than a simple cut. It also includes a blister that keeps reopening, a callus with a dark spot beneath it, or a pressure point that returns in the same place week after week. People often think the shoe is the whole story. Sometimes, the deeper issue is that nerve damage has changed how the foot bears weight, while high glucose has reduced the body's ability to repair the stress. That combination matters because repeated pressure quietly prepares the ground for a more serious wound. The practical move is to stop breaking in the same painful shoe, avoid bathroom surgery on calluses, and have persistent pressure spots examined before they split open. In diabetes care, location matters. The same spot returning again and again is often a sign of abnormal pressure, not just tough skin. Do not wait. Now we reach the warning no one should watch casually. An open sore, a draining spot, redness that keeps spreading, warmth around a wound, a bad odor, or skin turning dark gray or black is not a give it another week situation. Those are danger signals. Diabetes can lower sensation so much that damage advances faster than the person feels it, while reduced circulation and slower healing make rescue harder once tissue begins to break down. This is why some people are shocked by how serious the problem becomes before the pain ever seemed severe. The foot is no longer whispering. It is asking for urgent help. The correct next step is immediate medical assessment, not after the weekend, not after trying one more cream. The sooner you protect tissue, the better the chance of preserving mobility and independence. Step back now and look at the pattern as a whole. Tingling, numbness, skin cracks, color change, swelling, repeated infection, nighttime pain, callus pressure, and delayed healing may seem unrelated when viewed one by one. Together, they form a much clearer picture. They suggest that nerves, skin, blood flow, and repair systems may all be under strain at the same time. That is exactly why the feet matter so much in diabetes. They sit at the far end of the body's wiring and circulation, so they often reveal silent trouble early. The strongest response is not fear. It is routine observation before a small problem becomes a large one. Here is the 10-second tip I want you to remember. Every night, in good light, do one quick 3-point foot check before bed. Look for a color change, a crack, or a sore. 10 seconds, both feet, every night. If you cannot see the bottom clearly, use a mirror or your phone camera. That tiny habit can catch trouble while it is still easier to treat, easier to explain, and far less likely to threaten your balance or your freedom. And remember this final point. The feet are often early messengers, not late decorations. If they have been trying to tell you something, your job is not to feel embarrassed or to hope it disappears. Your job is to notice, document, and act. That is how small warnings stay small. That is how people keep walking on their own terms. These 9-foot signs are not just random annoyances. They are 9 chances to notice a silent problem before it grows larger. Tingling, numbness, dry cracking skin, color change, swelling, repeated infection, slow healing, nighttime pain, and dangerous sores can each be easy to minimize when seen alone. But together they can point toward diabetes or blood sugar trouble that deserves attention. Please do not hear this as blame. Many people were never told that the feet can reveal so much, so early. The goal is not to scare you. It is to help you catch what others miss. You are not overreacting by paying attention tonight. You are simply giving your future self a better chance to stay active. Tonight, take one immediate step. Sit somewhere with good light and check your feet carefully. Look at the tops, the heels, the soles, and between the toes. Notice anything unusual. Pay attention to color, cracks, swelling, blisters, drainage, or places that no longer feel normal. If any of these warning signs are there, contact your doctor promptly and describe exactly what you see and feel. That one decision can protect far more than your feet. It can help protect your balance, your mobility, your independence, and your long-term health. Early action still matters, very much. The sooner diabetes or nerve and circulation problems are identified, the more chances you have to slow damage and avoid more serious complications later. Even when the cause turns out to be something else, checking early is still wise, because feet often reveal circulation, skin, and nerve problems before they disrupt everyday life. Please share this with someone you love, especially a parent, partner, or friend over 50. Subscribe for more clear doctor-style guidance on health after 50 and 60. Then leave a comment and tell me which sign surprised you most, or what question you want covered next. Thank you for spending this time on your health. Stay observant, stay steady, and take good care of those feet. They may be telling you more than you think.